This program is a paid commercial announcement and in no way represents the views of WPH.D or its management.
Talk Radio 1210 WPH.D, WPH.D-HD, WOGL HD3 Philadelphia. Now, Health Watch, featuring Dr. Molly FANTASIA, the PhD doctor and founder of Innovative Medical Associates, with valuable information that could help you improve your quality of life. Now, Health Watch, and your host, John Damazzi.
Good morning and welcome to the show. As always, our mission statement is to get you healthy. At least we'll do our best in this hour. All right, we'll pack it all in, and we hope you'll stick around for the entire program. Health Watch every Sunday, 8 till 9, Talk Radio 1210 WPHT. And as you heard the man say, Dr. Molly FANTASIA is here, the PhD doctor and the executive director and the founder of Innovative Medical Associates, Marlton, New Jersey. We'll go through the whole thing about what Innovative Medical is all about and how it's unique and how it can help you and your family improve your overall quality of life. Like I said, that's the mission statement here on the show. And as always, if you have a question for Dr. Molly, 855-839-1210. A lot of times people call in and say, I have this particular challenge, and if that's your case, then feel free to call in, and Dr. Molly will do her best to kind of help you through it. 855-839-1210, 855-839-1210. Dr. Molly, Innovative Medical Associates is unique how?
Where do we start?
That's right.
Where do we start, John? So it's very unique. First of all, we are a licensed facility, and the collaboration of healthcare providers actually work out from my facility. So we can do anything any primary care physician can do. If you need an antibiotic, we can prescribe an antibiotic. If you guys need some antivirals, we can do that. However, the real philosophy of our group is we want to limit the amount of pharmaceuticals you need to take to effectuate the change by using God-given ingredients or natural ingredients to help you do that.
Do they work, the natural ingredients?
Question.
Everybody asks you that, right?
Right. Everybody asks me that, and I would urge everybody to come in and talk to my patients because they're there. It definitely works. Part of the biggest problem about going out and getting your vitamins and getting certain substances that can effectuate a change for you or make you even feel more healthy is that you just can't get enough of the therapeutic dose other than through the hydration therapy. So hydration is our cornerstone.
And if you've visited your clinic at any time, and of course I'm there twice a week, but you look at the
Not
bags.
Because you're sick.
No, that's right.
Because you're well.
That's right.
Right.
Everybody asks that question.
That's right.
When am I going to get better?
What's the matter with John? Nothing. Everything is great, and we want to keep it that way.
That's right. But it's interesting because you look at the bags, and sometimes people will say, lovely Linda, what's in my bag? And, it's like you can't possibly get that in a health food store, right?
And you can't get things that work synergistically together. I mean, look, if you go into the right health food store, they may be able to send you in the right aisle. That's a fact. And there are some guys. I have a patient who owns a health food store. He's an extremely knowledgeable guy. But most times you go in there and it's the luck of the draw. The bottom line is this. You got to get to the therapeutic level, no matter what you take, to effectuate the change you're looking for. So let's just go back to traditional drugs. When a doc prescribes your antibiotics, what does the first thing he tells you to do?
Take all the pills.
Take everything. Why? Because somewhere between the first pill and the last is the real therapeutic dose.
Right.
And that's the point. That's why this type of therapy only works when you get the patient to the therapeutic level to help a patient, effectuate the change they're looking for, keeping the patient safe. That's the other thing, John. Nobody in our clinic, none of the healthcare providers in our clinic will prescribe something that isn't safe for the patient. There's a medical component, and we've got to look at that. Do no harm. But we also want to do good, as they say.
When your docs prescribe and when you talk to patients about prescribing, a lot of times when you go to doctors, you get one pill and then you need the second pill to counteract the first pill.
Right, side effects.
And obviously that's not your philosophy.
We want to reduce the side effects, and the longer we're out here, the more new drugs that are out, the greater the side effects. Now, look, when you need a drug, I don't encourage anyone to throw away their conventional medication. But I will tell you, it would be a great thing to utilize some natural substances to help minimize some of the side effects for these particular drugs. Blood pressure medication is one of those things. We can start a patient on one blood pressure med, and now all of a sudden you went from a smaller dose to a mega dose, and you got the side effects. You were one of those patients when you first came to me.
That's right.
And what did we do? We were able to prescribe 2 smaller dose drugs with very little, in fact, no side effect, and actually manage it with a more natural substance. And what we want to do is look at that kind of thing, examine that, sit down, have a team meeting, and let's make the patient's quality of life better than ever before.
You know, one of the things that we hear constantly these days, and we've been for the last year and a half, is this whole COVID thing and the Delta variant. But I wanted to make mention of this. And we talked about it last week. You have a patient who had post-COVID, came in,
big time.
and I spoke to her because she was there the same day I was.
Right.
And she said, nothing really helped me until I came here.
Yeah.
And the other thing was
the juice.
Right. And the other thing was, I never felt during COVID like I even needed a vaccine, even though I got it, because the immune system was so strong. I always felt like all of that, the therapies were helping.
Well, John, that you brought up an interesting point, because what you're talking about is immunity. Immunity versus what? Immunization. And so the thing about it is, yes, you get immunized by taking the shot because they're putting something in to really tune up your own immune system. Well, in many cases, that wasn't really, you already had a heightened immune system, so the one shot probably did the job for you.
Yes.
You see what I mean? There are ways to do this. I'm not telling people not to get the shots. We get the question every week. I'm not telling anybody not to get the shots, but I'm also saying you need to have your own immune system in good enough shape that you will be immunized against many things, not just that particular virus.
Yeah, I was having a conversation with a friend yesterday, and she said to me, she said, you probably didn't need the vaccine because you were going to Dr. Molly the whole time, and your immune system was so strong. I mean, it's a theory, but obviously there was merit, because I never felt anything.
I had patients who stayed with me through the whole thing and did pretty well. But I also said, look, you don't be cavalier. You've got to look at your own health and make a decision. But I certainly am not an anti-vaxxer, as you know.
So innovative medical, bottom line is it's natural therapies delivered via hydration to help a variety of conditions.
And mostly improve the quality of your life. This is the bottom line.
And it's been said, and we've talked about it here on the show, and we're going to talk about it again today, later on in the show. Many times people come to you kind of as desperation.
It's desperation medicine.
They've been everywhere, and the last doctor said, well, listen, I really can't do anything more for you. So it happens.
Yes, that happens. And, and when we go into some of the conditions this week that I'm treating, I would say the earlier you get in, the better off you are. Because, we help a lot of people through conventional cancer treatments. And who does the best? People who really follow a hydration protocol that helps their own immune system accept some of what the chemo or the radiation is doing. And then what does it do? It keeps you well enough to continue a program that the oncologist might want to use. Look, we see this all the time, John.
Okay, we are coming up on our first break of the morning. Our program is called Health Watch, and you'll find us here every Sunday, 8 till 9 on Talk Radio 1210 WPHT. If you have a question for Dr. Molly, and we always tell you this at the beginning of the show, call in now, because we like to spend some time with you, and we do get calls at the end of the show, and we can't really talk to you. So let's not let that happen. 855-839-1210, 855-839-1210 is the number here in the studio with Dr. Molly Fantasia. I'm your host, John DeMasi. It's Health Watch, Sundays 8 till 9 here on Talk Radio 1210 WPHT. Back with more of today's Health Watch after these words.
Dr. Molly Fantasia of Innovative Medical Associates and her staff are proud to announce their new line of skincare products, developed in conjunction with renowned area dermatologist Dr. Harvey Glass. Dr. Molly has put together products that are all natural, healthy, and valuable with regards to proper skincare. Check it out on the web right now at innovativemedicalassociates.com. Click on products to buy, and you'll see the entire line of skincare ready for purchase. There's the Bamboo Charcoal Cleansing Gel, Vitamin C Plus Cream, Rich Day Cream, and so much more. For the complete list of Innovative Medical Associates exclusive skincare products, visit their website at innovativemedicalassociates.com. You can contact Innovative Medical Associates at 856-489-0505, 856-489-0505, and ask about scheduling a relaxing and soothing facial with an Innovative Medical Associates esthetician. That number again, 856-489-0505 for Innovative Medical Associates.
Welcome back to Health Watch. As always, operators standing by during the course of our show, and you can contact them if you want to find out more. Say you're a little bashful, you don't want to come on the radio. Well, you can call the operators, 856-489-0505. Ask any question, ask for more information, or most importantly, make an appointment to sit down with Dr. Molly. The initial consultation is complimentary, and you really do learn a lot when you do that, and that can help you make a decision whether you want to move forward or not. All you have to do is call right now, 856-489-0505. They're there during the course of the show, and they're there after we leave you at 9 o'clock. So feel free to call 856-489-0505, and the website, innovativemedicalassociates.com. Innovativemedicalassociates.com is the website. And the show is Health Watch, Sundays 8 till 9, Talk Radio 1210, WPHT. Again, our number here in the studio. If you have a question for Dr. Molly, 855-839-1210. You always like to talk about cases, Dr. Molly, and it kind of helps the audience understand what you do when confronted with a situation. And I know you wanted to talk about neurodegenerative diseases this week.
Right.
So let's get started, see where we're going with this.
Thank you, John. And you know what, John? There are so many of these that have overlap. You know, everybody thinks of neurodegenerative, they think of Parkinson's, number one. And Parkinson's is a pretty bad condition. But Parkinson's is one of them. Have I had Parkinson's patients? Yes. And, you know, the treatment for Parkinson's, of course, people know about carbidopa and levodopa and certain medications that the patients use. And by the way, they're pretty harsh medications. They have to be used correctly. Have we been able to improve the quality of life for some Parkinson's patients? The absolute answer is yes. Glutathione has been researched very carefully for the past 20 years, actually. There was several physicians, several osteopathic physicians who were functional in nature, who were using glutathione in high doses during the 90s. And in addition to glutathione, they're using another amino acid like alpha lipoic acid. Have we used those protocols? Yes. Have we enhanced those protocols in 20 years? The answer is absolutely yes.
Talk about, when you're talking about neurodegenerative, people think that this is MS, or is
MS, sure.
So is there a difference, or what?
Sure. And that's the deal. Here's the interesting thing. In the old days, if you remember, your old doc, and by the way, I don't have any old docs. Just to put it out there, guys. In the old days, docs could rule out. In other words, if you presented with overlapping symptoms of both, let's say, Parkinson's, like syndrome, and MS, the doctor would rule out one or the other. And there are tests that would do this, including radiology, to look and brain scan, and they look at the areas of the brain that was. Today, we have to call that differential diagnosis. So it's a little more complex. And the reason being is the insurance has issued the criteria that you need to absolutely say this is the right condition. So, yeah, I've seen patients with MS. One of my physicians has MS. And what do we do for that? Also, we use high doses of glutathione, high doses of biotin for that. B vitamins, it's an interesting thing. And you know, I have several extractions of B that I use in the hydration therapy. And we use B vitamins also in terms of that, alpha lipoic acid. And you've got to get a lot of what? antioxidants. And what's one of the best antioxidants out there, John?
Vitamin C. There we go.
So here we go again. In other words, you've got to get to the therapeutic levels of these particular substances. So yes, we've treated MS patients and we have a special propensity for it because one of our medical directors has MS. But this week, I actually got a patient that has something called MSA, which is multiple system atrophy. And it can mimic Parkinson's. How do you tell the difference? Well, hopefully they go to a very good neurology person prior to coming to us. And by the way, he suffered for many, many years with this. Only the symptoms weren't as severe, but as we got older, the symptoms progressed. So in this case, he has slowness of movement, tremors, rigidity, clumsiness, incoordination, and more importantly, he has varying blood pressure. So he has hypostatic blood pressure, which means it can go from up to bottom, in and out. He can really have some trouble. This is a very, very severe condition. It affects many people, but not enough for us to put a whole lot of money in it. Okay, about 20,000 people in the U.S. suffer for this. So there's no big impetus for us to really do a lot of research in it. But what I did in terms of the research of this is I found that there are many natural substances that can help this patient. And it includes one of my old favorites, ashwagandha.
I remember a long time ago, someone said to you, what is your favorite supplement? And you said...
Herb, yeah.
Ashwagandha. I remember you said that. And I looked for it in the health food store.
Yes, and it's great to look for, but what we want to do is use it properly. So ashwagandha has to be given in the proper amount for a patient, and it really enhances mental capabilities. But I have to tell you something else. A patient like this would also benefit from the hydration use and tinctures of ashwagandha, and also another favorite of ours, curcumin. So what is that? It's an antioxidant. And do we have that in IV? You bet. You bet.
So this particular patient, I mean, talk about a challenging condition, and he's been suffering with this for years.
He was a very bright boy, by the way.
Also understand he had balance issues. I mean,
big time. Balance issues, nerve cells to the brain. So what's happened is he has a particular alpha protein. I'm not going to go into that. That's how they discovered that this was his particular problem. And several parts of the body are affected with this. So the autonomic features are the real one, and that really, the autonomic features have everything to do with your blood pressure, with bladder, with sleep, erectile dysfunction, those kinds of deals. So what you want to do, and coordination is very important in these patients. Not so much the tremors, not as much tremors as you would see in a Parkinson's patient many times. But again, you can't just put a person in one square peg because, people are different. But
yes,
this condition is a very, very bad condition, and there are natural substances that can help this person.
So I guess the bottom line here is, people should contact you if they have some kind of an issue, and good chance that you have a protocol to treat them.
We would certainly try to help improve their quality of life. Just think, if we could improve his balance only, what a difference that would be. If we could help with the medications that he's on to improve that hypostatic blood pressure, means up and down, the dizziness, the balance, that would be a wonderful thing. And that is our hope right now, giving this with some herbals and that kind of thing.
And I would think with a case like this, and you said there's only 20,000 cases in the country.
Yeah.
I would think that there's not a lot of places for him to go to get some help.
Apparently not. What you have to do in a situation like that is look for a functional medicine person and really borrow from a lot of other neurodegenerative diseases. That's the key. In other words, you take some of the supplements that help in some areas because there's no data for this. Very, very little data. I researched the entire PDR of herbal remedies to actually put together the herbal piece of this particular case. And I have another case that is equally as challenging, which we'll get into.
We'll get into it after the break, right? Because you have many challenging cases.
There's no question.
You've always had them. I mean, from the beginning of time, you've had many challenging cases.
What these neurodegenerative they're unbelievable.
Okay, so let's talk about a person who may be listening to this and who has an issue of some kind medically and doesn't really know what it is and went to a few places, and we've heard this story before 100 times. Where should they contact you and say, "Hey, Dr. Molly, I don't know where to go"?
Obviously, we want to work as patient advocates as well.
Right.
So, we're not going to make a diagnosis of MSA or PSP or any of those. You're going to go to one of the institutions with a very good neurological department. But we certainly can gear you in that direction. And once a tentative diagnosis has been made, I will say this, many times because some of these diseases overlap on each other, there's never any real, actual, unbelievable diagnosis made in that moment. It takes years. And it takes the right doc to send you for the right testing, whether it's blood and or radiology, brain scans, for example, and look at the areas that are affected by the proteins, etc.
I know many times people come to you and say, "Dr. Molly, I've been here, I've been there, I've been everywhere.
Yeah,
and
frustration,
I don't know,
desperation,
and I don't know what's wrong with me." So, I mean, you've heard this many times, right?
Desperation. The other thing about neurodegenerative, I worry about it all the time because of Lyme disease. Post-Lyme disease can definitely affect the brain area, and people really tell them, "Oh no, you're just dreaming this." No, they're not. They actually have it.
Yeah. Okay, we are coming up on just about the halfway point of the show, and again, our program is called Health Watch. You'll find us here every Sunday from 8 till 9 here on Talk Radio 1210 WPHT. Dr. Molly Fantasia is here, the PhD doctor, the executive director, the founder of Innovative Medical Associates, Marlton, New Jersey. And the number here in the studio, if you have some questions, you have a medical challenge. We've been talking about some unique cases, and if you just simply have something that you want to run by Dr. Molly, good time for you to call in. We do have some open lines at 855-839-1210. 855-839-1210 is our number here in the studio. Again, it's Health Watch, Sundays 8 till 9 here on Talk Radio 1210 WPHT with Dr. Molly Fantasia. I'm your host, John DeMasi. More of today's version of Health Watch after these words. Back here on Health Watch, as always, operators standing by at Innovative Medical Associates. They're there right now. And you can call 856-489-0505. When you call, what do you do? Well, simply ask the question you'd like. And if you want to make an appointment to sit down with Dr. Molly, you have a particular medical challenge you want to run by her, really you get all your information or the good stuff when you do the initial consultation, which is complimentary. So you do that, set it up, 856-489-0505, 856-489-0505. And the website, innovativemedicalassociates.com, innovativemedicalassociates.com. You check us out on the web, and you'll see a lot of the past radio shows, so you can go there and look for a particular topic that Dr. Molly talks about. You can get information that way as well. A lot of ways you can do it. Again, innovativemedicalassociates.com is the website. Health Watch is the show, Sundays 8 till 9, Talk Radio 1210, WPHT. Before we get back into the show, just want to remind you that Dr. Molly's new book is out. It's God's Ingredients 2, that's TOO, My 30-Year Journey in IV Nutritional Medicine, Dr. Molly Fantasia. Her new book, it is available on Amazon.com and anywhere you get books. My God's Ingredients 2, TOO, My 30-Year Journey in IV Nutritional Medicine. And I hope there's a chapter there on.
Oh, there's a chapter. There's a chapter.
Okay.
I have some
it should be half the book, right?
Nah.
Okay. 855-839-1210 is our number here in the studio. 855-839-1210. If you have a question for Dr. Molly, we wanted to talk about, and you like to talk about some patients and particularly the real challenges. And your patient with PSP.
Right. I've spoken about her before. And she's been our patient for about a year and a half, maybe 2 years. And it's interesting because this is a progressive, disease that really, the stiffness of this patient is incredible, right, John? You've seen her.
I've seen her, yeah.
I mean, God bless her husband. He's a very well-known guy, and he tends to her, and the kids tend to her in a way that's just absolutely loving. But the important thing here is she comes into our clinic, and of course we've been treating her with nutritional supplements, as well as there is no medication for this condition. This PSP is progressive supranuclear palsy, and it really has a lot of problems related to speech, movement falls, difficulty swallowing. So she can't really take oral supplements that easily. Think about that. So what we did was we put together a program of nutritional supplements to include many of the things that we know that help in neurodegeneration. However, this particular disease is so rare. I think this one has maybe 3 in 100,000 people worldwide have this condition. So another condition that really isn't well researched, and or actually much work is being done in this to help these patients. But what we decided to do with the aid of a couple of consultants that I had, we decided to try regenerative medicine on this particular patient. And regenerative medicine is the use of organic material, things like stem cell, things like cellular material, these kinds of things, extracted from platelets and the growth factors and all. So we've used this IV, and we have a full program for her. Again, this is pretty cutting edge because there is no cure for this condition. But what happened this week, John, it blew me away. Her husband texted me and said she had more eye contact, which is very interesting, and she was able to talk to him in full sentences more than she has, and he said it was pretty good. We've also used something called light therapy, where various bands of light are used with our hydration therapeutics. And in this case, we found that has helped improve her ability and the rigidity that she has. Unless you see a patient like this, you can't really, when I use the term rigidity, you really can't get it.
Oh, I've seen it. No, I know.
I don't know how else to explain it,
exactly.
John.
No, you're right. I mean, I've seen it.
You're like a mummy.
Yeah,
you're like just
well,
like a mummy.
That's basically, and when you said about a sentence, and that's a significant step, because if you see her, you say to yourself, geez, I don't know how she could ever do that, but she did it. So that's positive.
I really believe it's in the more natural, younger cells, this kind of thing, that we were able to put her on. And also the anti-inflammatories. And again, when you have a patient who has difficulty swallowing, how do you do this other than through hydration? How do you do it?
You really can't,
You
right?
really can't. You'll never get her to a therapeutic dose to see any change in her status. So that's why this case is such a tragedy, but also one that my entire staff, all the docs and myself, are very, very interested in keeping the log on this case.
We often talk about these kinds of cases here on the show, but we want people to understand that you have a lot of people who have, I don't want to say simpler problems that you can help them with.
Of course. Look at the post-Lyme. Let's go back to the post-Lyme. It affects your quality of life, because what does it do? It's causing you to have more simple type of symptoms than these neurodegenerative diseases that I was talking about, but similar, where you might have some tremor, where you might have some pain down the spinal canal. Those are the kinds of conditions. And if not treated early with the antibiotic, the Lyme disease with the antibiotic, believe me, you're going to get a host of bacteria, viruses, spirochetes that are inside that Lyme tick that delivers it to your body. And there are a multitude of problems that develop post-Lyme.
You were talking earlier, we were talking about neurodegenerative, and we're talking about this PSP patient. And we are going to talk about Parkinson's in a bit because I know you had a patient with that. Let's talk about that, the Parkinson's patient. What is the situation there?
The Parkinson's patient is also a very difficult patient. But the first thing that I believe really does help is the alpha lipoic acid, which is amino acids delivered in an appropriate dose, also help. But I also think that patient would be a great candidate to try with the more natural cells delivering the regenerative medicine to a patient like that. And we have done that, and indeed he had some relief. Here's the problem with all of this, John. The earlier you get in, the better the outcome.
Absolutely.
Right?
Absolutely.
I mean, this is the kind of condition. You don't wait till everything is exhausted in conventional medicine and then come and see us and say to my guys, hey, I expect a miracle. It won't happen. This isn't holy water. You've heard me say that before.
Many times.
And I will say it more directly as it relates to the neurodegenerative disease because they are so difficult to manage the symptoms. So if we can manage the symptoms and improve the symptoms, let's say 20%, that's a big win for patients like this.
Let's talk about, we've talked about some difficult patients, but let's talk about some more common things that you see.
The autoimmune,
okay.
Sure, more autoimmune, because some of these things can be genetic, some of these things can be subsets of autoimmune diseases. So yeah, the autoimmune, again, it's high antioxidants, it's high amino acids, it's the use of the amino acids in synergistic ways along with the vitamins and minerals. So again, it's not one size fits all, but when I have a patient like Sandy who's got many, many problems because of the rheumatoid, right, and the autoimmune, right, that's the key. How do we help a patient like that? Well, if we can give her 3 good days a week without the pain that she feels in the joints and in the muscles, that kind of thing, we've won. And we do that again with a subclinical dose of a traditional med. And that is true for lots of the neurodegenerative diseases too. John, there's a synergy to everything we do. It isn't one, it's not just vitamin C. I had a patient come in the other day and said, well, I only want 50 grams of vitamin C. Well, please don't come to me, because don't come coming in telling me that's all you want. If that's all you want, go to a spa, okay, and take the vitamin C off the shelf. That isn't what we're going to do. We're going to evaluate what's going on for you and then map out a complete protocol. And I think I have a lot to do with that. I am so lucky. I have a wonderful medical director who gets it. You don't just say, here, take this, along with your medication and call me in the morning. That's not what we do. You're laughing.
Remember the old doctor?
Yeah,
take 2 aspirin, call me in the morning. Yeah.
You know what I'm saying, John. Yeah. You can't walk into me and say, oh, I want my hangover remedy. That's not what we do.
Explain the length of time that you would have to, because
sometimes
people will say to me, how long have you been coming here? And I said 20 years, and they want to faint at that point.
No.
But explain the expectations. Do you come 15 treatments, 20, 30?
Usually we start to see it depending on when you come in. Now, obviously, if you have these neurodegenerative diseases and you've had them for 5 years, don't think 5 treatments is going to make the difference. Not going to do it. What's going to happen? We have to reach an antioxidant level that works. So in this case, I would say for most people start to feel better from traditional type of challenges in the first 5 treatments. But that's not the only. That's 5 weeks if you come in once a week. Generally between 10 and 30 weeks is when you really see ongoing change. And most of my patients will continue with us because they've reached a level where the therapeutic level is there, and now they want to keep it there, John. That's what you're doing. That's what you're doing.
Is really maintaining.
That's right. That's what you're doing, because you don't have one condition, John.
No. I know that.
Well, I don't want to be the one to say it, but that's what happens as we get older, right? We may have diabetes, we may have some cancer, we certainly will have some rheumatoid issues, right? It's just normal. And again, we want to do what is really appropriate for each individual patient.
All right, we're coming up on our final break of the morning, and that means you still have time to jump in if you have a question or a thought for Dr. Molly. You have a medical challenge you want to run by her. Well, feel free to call in at 855-839-1210. That's the number here, 855-839-1210. Our show is Health Watch, Sundays 8 till 9, Talk Radio 1210, WPHT. With Dr. Molly Fantasia, I'm your host, John DeMasi. We're coming back. More of today's Health Watch after these words. And we're back here on Health Watch. As always, operators standing by at Innovative Medical Associates, and they are there right now, and they'll be there well after we leave you at 9 o'clock. In fact, you can call this afternoon. They'll be there. 856-489-0505. 856-489-0505 is the number. And remember, the website, innovativemedicalassociates.com. InnovativeMedicalAssociates.com is the website. And just in case you missed any of the show this morning, or you heard it, you like it, you want to hear it again, we have our Health Watch replay, Sundays 4 until 5, right here on Talk Radio 1210 WPHT. Driving to Philadelphia last week, Dr. Molly heard the show, heard the whole show. It was enjoyable listening to us because we don't get to hear each other.
That's
we don't
true.
get to hear ourselves, but it was good. So you can check it out 4 to 5 this afternoon. Health Watch is the show, Sundays 8 till 9, the live version here on Talk Radio 1210 WPHT. Let's go to the phones. Marcia is in Hackettstown, New Jersey.
Wow.
Marcia, good morning. Welcome to Health Watch. You're on with Dr. Molly.
Hi, Marcia.
How are you, Dr. Molly? I am so glad that I was able to listen to you today. Where were you before? I never listened to my radio when I drive, but I think it was a miracle. So
I'm glad.
I have been diagnosed with Lyme disease for many, many years, and I was treated with antibiotics continuously for 2 years. I even got IV antibiotics, and I think that, along with multivitamins and all natural remedies, helped me get to the point where I am. But I realized that I could never get rid of it. It's been in my system for a long, long time. I think I probably had it for 15 years, was diagnosed about 5 years ago. So it's kind of late for me to get rid of it. So I'm managing my symptoms, but right now it's coming to a point that I'm forgetful. For example, I grab a bottle of water and I put it somewhere else because I'm ready to go to work, and then I forgot where I put it, and I go back to where it was earlier, and then in my mind I'm thinking, okay, I have to put it in my bag, and then I go back and say, oh, I have to put it in my bag when I already did it.
Yeah,
and
I
it's
understand.
frustrating. So I don't know if your therapy would help me. I think it will,
I know it
So,
will. I know
of
it will.
course.
I know it will. But in the interim period, could you tell me what are you taking orally to help your memory?
Okay, so I was taking a lot of medication, and after COVID hit, I wasn't able to go to my Lyme specialist. And I decided, you know what, I'm unable to refill my prescription. I couldn't get even over the phone a prescription or anything, so I just stopped. That was last year, June, and ever since then, I had been okay, but now my the fogginess, it's getting worse. So I'm not taking anything now.
Okay.
Not
Listen.
even vitamins. I'm not
Listen
taking
to me.
anything.
How about it, John? She's a perfect example of somebody who comes in for the free consultation. And since you're dry, do you live in Hackensack?
Hackettstown.
Hackettstown? You live in?
Down.
Okay, good. Come down and see me in Marlton. I'll tell you why. The consultation is complimentary. I would like to sit with you for 20, 30 minutes and see what are your symptoms, what can we do, and I know we can help. We could give you reduced glutathione. I would give you high dose vitamin C, assuming you could take that. I'd want to see any of the blood work you've had recently. I'm sure you're not testing positive on the Lyme titer right now, but that doesn't mean you don't have the post-Lyme syndrome. And I know it affects every part of your body. So also alpha-lipoic acid to help with nerve pain. And come in and see us, will you? Some homeopathics, all IV. God bless you. God bless you.
Very
Marcia.
nice.
Thank you.
Thank you very much, Dr.
Marcia, thank you.
God bless you.
And good luck with that. Thanks for
Thank
the
you.
call.
That's a wonderful case that I know we could help, and pretty quickly, I think.
Yeah, you know, it's interesting because Marcia is in Hackettstown. She's pretty far up there.
I know.
But patients, you have patients from, they drive 4 hours.
I have patients who drive 4 hours from way up in the Alleghenies.
Right.
I have patients who come in from Maryland. I have patients who were in from Florida who
Yes.
are coming back at the end of September.
And how about Indiana? That's another one.
Indiana, who come in regularly every 3 months for a couple of days. And there are things we can do to help this nice lady. And I know what she has is she probably has the viruses, the bacteria, and the spirochetes that are left over from the Lyme tick bite.
All right, 855-839-1210 is the number. We have a couple of minutes left. If you have a question for Dr. Molly or a medical challenge you want to run by her, as you just heard previously, feel free to call 855-839-1210.
One of the things I would tell her right now to go out and get something called enzymes. You know about this because it's something we use a lot.
Right.
I would tell her to get a particular brand, and I would start her on several of those because they're long-chain amino acids, and we give a lot of that in our hydration bag, but they serve as catalysts to the body, and a catalyst means it helps promote a particular chemical exchange. It's not part of it. It just helps promote it. And so the enzyme reaction would be something I would put her on right away, even before she came to see me.
All right, we talked today a lot about neurodegenerative. We touched a little bit on MS, and you had the patient with MSA, and then we talked about the patient with PSP and Parkinson's.
They're rare diseases.
They're rare, but let's talk about what works in general for people in terms of how you can help them with whatever. We just heard about Lyme, and I'm sure there's heart, and I'm sure there's cancer, and I'm sure there's all of those.
I have protocols that will really look at all of this, and thank God for my medical director because he's great. And together, what we do is we put a protocol in place for no matter what you have. Chelation has been around for 100 years, right? And that's the use of a man-made amino acid for cardiac conditions. Vitamin C is an all-around wonderful, wonderful antioxidant and pro-oxidant. And one of the things that I believe from our extractions of vitamin C, we extract everything from God's ingredients. That's why it's the name of my book. Because we believe the body, this is a theory, the body has an innate ability to really digest those particular supplements and utilize them better than man-made stuff. So, again, it's going to depend. Vitamin C is one. Glutathione is another one. Alpha-lipoic acid is another one. Lactoferrin. I talked about lactoferrin a few weeks ago. Lactoferrin's very, very good for the immune system. So there are so many injectables, homeopathics that I use that are incredible. And in Germany, Italy, Scandinavia, they're using these homeopathics like we use our pharmaceuticals. We write a prescription for pharmaceuticals. They write for the homeopathics. So there are so many things that are out there to help patients. And again, I caution you, don't throw away your medication. You always need to be supervised by a medical practitioner who can really help you get through this and maintain your quality of life. That's what we're all about, quality of life, John.
And, don't just go into the health food store and say, I heard Dr. Molly say, give me two of those, one of those.
You know what I say?
It's like
Chinese,
right, exactly.
The Chinese restaurant. Give me 2 vitamin C's and add a couple of glutathiones and don't forget a little alpha-lipoic. Can't do it, guys. You're not going to get that at my place. We don't have a menu that says, oh, this is for enhancement of your skin. We have collagen, though.
Yeah,
we can deliver.
I know you do.
But, listen to how I'm saying this. Everything we put into our body has a reason, and there's a methodology, and it works synergistically with other things.
And probably a good idea to get your book because that's kind of gets you started, right?
It tells you a lot of my patient stories, and they're all true, folks. And if you come in and see us, you might even meet some of those people.
God's Ingredients, TOO. That's her new book, My 30-Year Journey in IV Nutritional Medicine. Dr. Molly Fantasia has just written it, and you can get it on Amazon.com and anywhere you get books. It's God's Ingredients, TOO, My 30-Year Journey in IV Nutritional Medicine. Did you have fun today?
I did.
Okay.
I
Well,
did.
guess what? We're out of time.
Oh, no.
Sorry about that. But we're back next week. Okay.
Thanks.
That's going to put the wraps on another edition of Health Watch. Don't forget, you want to talk to Dr. Molly during the week, or you want to make an appointment to sit down with her, you can do it right now. 856-489-0505. 856-489-0505. And don't forget the website, innovativemedicalassociates.com. innovativemedicalassociates.com. Also, don't forget, we have our Health Watch replay. You can hear the show again this afternoon, 4 to 5, here on Talk Radio 1210 WPHT. For Dr. Molly Fantasia and everyone at Innovative Medical Associates, the lovely Linda, Barbara, delightful Dee, fabulous Fran, get well soon, Joanne, and our nurses, Jess and Crystal, I'm your host, John DeMasi. Thank you for listening. Have yourself a great week and a healthy one. We'll do it all over again next Sunday. Health Watch, 8 till 9. Talk Radio 1210 WPHT. You take care.